Good day, I am Kyle Abigail Comonal from 12E, Group 18, and today I am going to perform my return demonstration of Leopold's maneuver. Basically, Leopold is a maneuver that is used or that we use to assess for the position of the fetus inside the mother's uterus. And this is also used during antepartum period for us to be able to know whether the baby is in a good position for labor, and also for us to know where to listen for the fetal heart tone. Now to start, of course, first thing to do is to perform hand washing. Okay, I don't have any jewelries on, so I'm good to go. Of course, performing hand washing before the procedure or before any procedure, that is to deter the spread of microorganisms. Okay, now that I have washed my hands properly, I am good to go to meet my client. Of course, performing the introductory steps where I greet and introduce myself to the client and to the people that she is with or her companions if around, and identify the client, verify the client's identity. So now I'm gonna go ahead to meet my client.
Come in.
Good day, ma'am.
Good day.
Okay, just wait a second. I'll just close the door. Okay. Okay, ma'am. I am Kyle Abigail Comonal. I am a second-year nursing student from Davao Doctors College, and I am your nursing student for today. Okay, ma'am. May I see your wristband, please? Okay, thank you very much. Okay, ma'am, please state your complete name.
Bernadette Comunal,
Okay, and your birthday.
March 19, 1976.
Okay, thank you very much, Miss Comonal. How would you like me to address you?
Just call me Nadette.
Okay, Nadette. Nadette, are you Bisaya?
Yes.
Bisaya would go. So, do you want me to speak in Bisaya or in a different dialect?
Just speak in English.
So, I have your permission that I'll be continuing to speak with you in English. Did I get it right?
Yes.
Okay, thank you very much, Nadette. Okay, so now or the next thing that I'm going to do now is to explain the procedure to the patient and how she can participate. We are doing this, explaining the procedure, because it can actually reduce the client's anxiety and it encourage the cooperation of the patient. Okay, Nadette, I am here now, or I am here today because I'll be going to do or perform Leopold's maneuver to you. That means that I'll be palpating this area of your body or your tummy. Okay, so we are doing this because this is for you and for us to know what is the position of your baby. Okay, and it also will be able us to know the presentation of your baby, if it's cephalic. Okay, so that could mean, or that means that the baby's head is down here. So we'll be able to know if that's the case or so. And in this procedure, we will also be able to know where to listen and for us to listen for your baby's heartbeat and for the fetal heart tone of your baby, okay? And Nadette, for me to be able to do that, I'm actually going to raise your shirt up, okay? Or I'll be asking you to do that later because we are doing that because we are actually going to need to expose your tummy in this procedure, of course. And that you will be lying in bed in this procedure. And it also involves me to be looking at your tummy, and I'll be touching your tummy in this procedure. So would that be okay with you?
Okay.
Okay, thank you very much, Nadette. So just wait a second. Okay, I'll just make sure that the doors are closed and the curtains are draped or down. Okay, that is for your privacy, of course, and for you and for us to be free from any distractions. Okay, the doors are closed and I can see that the curtains are draped, so I think we're good here. So now, before we start the procedure, or the next thing that I'm going to do now is to let the patient empty her bladder first, because we're doing that because actually a distended bladder may deviate the uterus and we don't want that to happen. Okay, with that, before we start with the procedure, now I will be assisting you to go to the bathroom or to the restroom, okay? Because actually, I'm gonna need you to urinate now or mag-ihi. Because, as what I have explained earlier, I'll be palpating your tummy or this area, and that actually include the area which your bladder is, and that can actually cause the urge for you to urinate or mag-ihi, possibly in the middle of the procedure, and we don't want that to happen. And if you have a full bladder, it also can deviate your uterus, and actually we don't want that too. So this is for your comfort, so that you will be comfortable all throughout with the procedure later. Okay, so let me assist you now to the bathroom. Okay. Okay, so while waiting for my patient to empty her bladder, so I'm just gonna go ahead now and explain what I will be doing next, which is to position my patient in a supine position. Okay, Nadat, I see that you have already emptied your bladder already. Am I right?
Yes.
Okay, thank you very much for that. So I'm gonna assist you now to lie in bed, please. Okay. Okay. Assist you. Okay, that's it. Going to flex your knees, position your legs. I'm gonna cover you up. Okay, Nadat, are you comfortable in this position?
Yes.
Okay, that's great to hear. Okay, as you can see, I have positioned my patient in a supine position after she emptied her bladder. We are doing this positioning the patient in a supine position because actually this position facilitates accurate assessment and it provides comfort to the patient. Okay? And as you can see, I have put one pillow under her head because this actually support also for the shoulders. And I have flexed her knees. As you can see, the knees are flexed because flexed knees can actually reduce the tension of abdominal musculature. That's why. So next thing I'm going to do now is I'm going to get a rolled towel and I'm going to put this under the patient's right hip. Okay, now that I'm going to put a towel under your right hip. Okay, can you move a little bit on that side? Okay, thank you very much. Okay, you can now lay back again and okay, just relax. Are you comfortable? Is it okay? Okay, that's great to hear. Okay, we are doing that placing a towel or a rolled towel under the patient's right hip because actually it shifts the uterus away from large blood vessels that prevents or does prevent in having the supine hypotensive syndrome. Okay, that's why. So now, to start the procedure, so next thing that I'm going to do now is to position myself. So in positioning myself, is since I am right-handed, so I'm gonna be on the right side of the patient. So as you can see, I am now on the right side and of course facing the patient. Okay, so we are doing this, or I am doing this because this is actually for me. Okay, to easily grasp the symphysis pubis of the patient. Later on, actually that is to be on the third maneuver. But actually, generally, this is for comfort, nurses and student nurses, for us to actually properly do and for us to easily do the first few steps in the Leopold's maneuver. Okay, and for comfort also in terms of us to prevent having back pains from overreaching. Okay, so now I'm going to start. Okay, now that I'm going to start the procedure. Okay, I'm going to expose your belly. Okay, that's it. Okay, so now that I'm going to start palpating your tummy, so you're going to be feeling a little bit pressure while I'm doing this, okay?
Okay.
Okay, so now starting the first step or the first maneuver, which is also called the fundal grip. So from the name suggests, so we will be palpating first here at the fundus. Okay, so we will be feeling the top of the fundus, as you can see, with using both of our hands with our fingers. Okay, feeling the top of our fundus, because we are actually doing this because actually the purpose of our first maneuver is for us to determine what part of the fetus is in here in the top of the fundus, or in the upper part of the fundus. Okay, so feeling for the baby's head or the baby's bottom or extremities. So we can tell if it's the baby's head if it feels hard and round, freely movable if it's movable, and ballotment, and breech if it feels softer, and nodular. So if we feel nodules here or nodular, that could indicate that it could be the baby's extremities. Okay, and if we feel squishy and somewhat curved, then that could be the baby's buttocks. Okay, so starting again, fundal grip. Okay, feeling here. So I actually feels that it is actually squishy and it is somewhat curved. Okay, so that means that it is the baby's buttocks in there. So what do we feel first? That is the first maneuver. Okay, so I'm going to proceed now to the second maneuver, or what we call the lateral grip, or it also called the umbilical grip. So now I'm gonna move and work my way, okay, palpating downwards here at the sides of the patient's abdomen. So here in the second maneuver, we are doing this for the purpose to determine the fetal extremities, the fetal back, and the anterior shoulder of the fetus. Okay, so in now doing the second maneuver, so I'm gonna actually, Dad, can you move on this side? Okay, to be actually near me. Okay, I'm going to assist you. Okay, that's great. Thank you very much. So now to start with the second maneuver, we're going to place one hand on one side like this. Okay, steady here for support. This is for support, and the other hand, as you can see, will do the work of exploring and palpating this opposite side. For the fetal back, we can tell if it's the back of the baby, if it feels consistent, long, and flat. Okay, and I'm now going to proceed to the opposite side. Okay, feeling or palpating for the opposite side. So this hand now will do the support, and this hand now will do the palpation. Okay, feeling for the fetal back. Okay, I actually feel here the consistency, and it's actually flat and long. So I think we have now located the back of the baby. Okay, and in here I actually feel a little bit of like protrusion that could indicate that this is actually means that this is the anterior shoulder. So now that we have located the back and the anterior shoulder of the baby, then we could estimate where to listen for the heartbeat or the heart tone of the baby. So that is actually the second maneuver for us to determine where is the back of the baby. Okay, now to proceed for the third maneuver, or what we call the pollex grip. Okay, so we are doing this third maneuver because we could actually here we will be able to know and feel for the presenting part here in the symphysis pubis of the patient. Okay, and also here in the third maneuver, we will be able to know if that presenting part here is already engaged or not, or is it engaged or not. Okay, so in doing this third maneuver, we're gonna don our hands like this. Okay, as you can see, just like making an L. Okay, because actually we're going to place this on the over the symphysis pubis of the patient, or the anterior symphysis pubis of the patient. Okay, so in here, just in the lower uterine segment, okay, using our thumb and these 4 fingers. Okay, so Nadette, I'm going to be palpating on your lower area of your tummy now, okay? You'll be feeling a little bit pressure. Okay?
Okay.
And it may be uncomfortable to you, so just bear with me. Okay, so now we're going to feel what presenting part is in here. Okay, I actually feel that it is round and it is hard. So this means that the presenting part is the baby's head. So now we're going to assess if the baby's head has dropped or has already dropped in the pelvis of the mother. So that means that we want to know if the head is engaged, or is it already engaged or not. So what we are actually expecting here to tell that it is engaged, that if we grasp the symphysis pubis, or what we have done earlier, if we lift up the baby's head, if we actually cannot lift or move the baby's head, then that means that it is engaged. And if we grasp it and we can actually move the baby's head, then that means that it is not engaged. That means that the head is floating, or what we call ballottement. Okay, so I'm going to do that again. Let's see if it is engaged. Okay, I can't actually pull or lift the baby's head, okay, towards me. I can actually move it, so that means the baby's head is engaged. So that is actually the third maneuver for us to tell what part, or what is the presenting part in here in the symphysis pubis, and to know if that presenting part is engaged or not. So now I am good to go to the fourth maneuver, or what we also call the pelvic grip. So actually, after confirming that the presenting part is the head, we can actually proceed to the fourth maneuver, because that is actually the reason why we can proceed for the fourth maneuver, is that in the confirmant, that in the third maneuver we have assessed that the presenting part is the head, then we can proceed to the fourth maneuver. Because actually here in the fourth maneuver, we are doing the fourth maneuver to determine if the baby's head is flexed or deflexed, and also the baby's attitude. So it is all about the head, that's why. Okay, so in doing this fourth maneuver, we're going to be placing our fingers of both of our hands, and we have to turn, okay, like this, in this direction, as you can see, facing the client's feet. Okay, so placing our hands like this. Okay, and we're going to palpate. Okay, so what we are actually expecting here is if we feel prominence at the same side as the smaller parts, or if we feel this smaller knobs at the same side of the, like if we feel prominence at the same side of the smaller parts, then that actually means that the baby's head is flexed. Okay, so that means that the presentation here is vertex. Okay, and if we feel prominence at the same side of the back of the baby, then that means that the baby's head is extended. Okay, as you can see, if the baby's head is extended, that could be the bump that we feel, or the prominence, and the back at the same side, so that means that the baby's head is extended, and the presentation here will be the face of the baby. Okay, so let's assess for that. What is the presentation? Okay, I have already felt the prominence. Alright. At the same side as the smaller parts that I am feeling here. So that means that the baby's head is flexed. Okay, so that means that the presentation here is the vertex. Okay, so that is actually the fourth maneuver for us to tell what is the presentation. So here is vertex, and the attitude, which is flex. The baby's head is flexed. So that the presentation is the vertex. That's why. Okay, so next thing I'm going to do now is to actually confirm and locate again the back of the baby for us to proceed to listen for the heartbeat or for the fetal heart tone of the baby. Okay, so I'm going to excuse me. Going to locate again for the back as what I have actually assessed earlier. I have felt the back at the left side. So actually, yes, I am actually feeling consistency and long and flat here at the lower left area or the left lower quadrant of the patient. Okay, now that we have located the back, so now I'm good to go to listen for the fetal heart tone of the baby. Of course, using the stethoscope, but we must keep in mind the normal fetal heart tone, which is in the range of 120 to 160 beats per minute. Okay. Okay, I'm going to start now. And make sure that the equipment is warm. Okay. For the comfort of the patient, so that the patient don't get uncomfortable, because if the equipment is cold, that could actually be the reason why the patient is uncomfortable. Okay. Okay. I have got now the fetal heart tone, and it's actually within normal range. Okay, so okay, now I'm going to cover up my patient since we are done with the procedure. Okay, and then I'm going to cover you up since we're done with the procedure. Okay, so I'm going to get this for you to be a lot comfortable. Okay, you can now lay back. Okay, I'm going to assist you. Okay, so are you comfortable now?
Yes.
Okay, that's great to hear. Okay, next thing I'm going to do now, since I have done the procedure and also I have now attained for the fetal heart tone, so I'm going to document my findings. So I'm going to record the location, the rate, and the character of the FHT or the fetal heart tone. Okay, and also all the informations that I have gained during the procedure or the LMP. Okay, so I'm going to document that now. Okay, and don't forget that we affix our signature, because this means, or this indicates, that the procedure is done, or that we have done the procedure. Okay, so that what I am going to do, or what I want to do now, is to sum up everything for you, all the findings or all the results that I have gained during the procedure. Okay, na that your baby's heartbeat or heart tone, or what we call actually here the fetal heart tone of the baby, is within normal range, so that's good, and it's regular, so that's also good. And with the procedure earlier during the LMP, or that Leopold's maneuver, we have identified now that your baby's position, I have put here left occiput anterior. Okay, now that means that this part of your baby, okay, this part of your baby, or what we call the what we refer as the occiput, actually is on your left side. Okay, so that means that your baby is facing on your right side, because this part is on the left side, so that's why. So now you know the where your baby is facing. So your baby is facing on the right side. Okay, and your baby lies longitudinally. Okay, because the head is here and we feel the buttocks up here during the first part of the procedure. And the presentation is cephalic, since the head is down here. And the presentation, as what we have assessed earlier, it's the vertex, and the attitude is flexed. Okay, so the head is vertex, that means the head is down, so the vertex is the presentation. Okay, so that is actually all my findings. So thank you very much for your cooperation. So do you have anything to clarify or ask before I leave? No?
No.
Okay, so I think we're good here. So thank you very much. I just don't want to touch that for since we're still on the risk of the pandemic. Okay, so thank you very much.
Thank you.
I'll leave you now to rest. Okay.
Yeah.